It's Dr. Christine Barron speaking. We thought, just in terms of children growing into adults, it made more sense to start with children, in which I'll talk about mild OI in children and young people. Next slide, please. This was meant to seamlessly just set the context of where I'm talking from. This morning there'll be many people from all around the country. There's 4 centres in England dealing with highly specialised OI. I'm speaking from Bristol, and our map across on the left. I'm sure you're all very familiar with the geography. Just a little bit about Bristol, the delight of the suspension bridge with balloons above, perhaps more familiar to many people with Wallace and Gromit image, and an image just off to the right of the Children's Hospital. Next slide. Again, just with Zoom, I thought it would be useful that you can see the faces of who's presenting. Myself on the right, some of the members of my team, on the left, some of my members' team on the left, joined by several of the OTs and physios and nurse specialists. Broader members in the team of orthopaedic surgeon, genetics, rheumatology, dental, but that's just setting the context of looking after patients with a whole range of severity, from severe to moderate and mild. Next slide, Richard. So just bringing us back to the title of mild OI, which would cause a question in all of us, so what is mild? So this is in comparison to the more severe end. Next slide, Richard. Next slide. So just here, what is mild OI and what do we all mean? One of the things that strikes me is we may all mean slightly different things. On the left, the very usual way of talking types of OI, and there's a lot of emphasis put on that. And whilst we might all be familiar, okay, type 3, that's more severe. Type 4 less so, and type 1, but I'm sure all of you have the experience that your own type 1 might be very different from someone else's type 1, and someone might have a lot of issues with it might be more moderate rather than mild. The central column here, I've put that we often mark the severity in medical terms of the fragility of the bones, about whether or not they fracture. But we're very conscious, really I've put in the third column, that there's so much more. Next slide, Richard. So just on here, I've captured some of the range of issues in mild OI. One of the things I wanted to emphasise is this does not mean that all these things necessarily happen in all people. I've separated this out into thinking, okay, infancy, what are some of the issues we're cognizant of that might make people's experience of OI different. Whether, for example, if in an infant this is the first experience of OI within the family, it's not yet a known entity, presents its own challenges. Similarly, if there's broader family experience of what OI is, that still creates the uncertainty in that baby about that crystal ball, what's it going to mean for that individual. So as a team looking after families and young children and infants with OI, we're conscious that the unknown element of whether or not things will be affected, whether or not there will be a fracture, is really important for the whole experience. Some of the things throughout childhood I've not put fractures on here. Yes, that's an entity we're looking at, but just the more subtle issues that can still cause a lot of issues day to day, because the collagen being affected in the ligaments means that they may be lax, and then fatigue in mobilizing, walking long distances in reception, into school, and the position of the feet or the knees may place more pain and fatigue on getting moving and experience during the day. So I'm not saying that's an inevitable outcome. I'm more emphasizing that's something as the healthcare team we're conscious of to look out for and provide strategies of how to mitigate those. And into adolescence, similarly, we're conscious whether the participation in school activities are there issues that we need to address. The next slide. Sorry, I've just noticed a message from Ben. So I have been talking as a disembodied voice during all of this time. Apologies to everyone. Hopefully you've been seeing my slides. On this slide here, the approach from the OI team, in the box up at the left, what I've put in terms of empowering and participation, I think is the central thread that runs through how we would like to feel we're delivering healthcare, irrespective of mild, moderate, or severe. Some of the things we're looking out for might be, are there issues with bones in terms of alignment or fractures? State of the teeth is really important, and we really emphasize important of dental care. Ligaments that I've mentioned. One of the things also we're conscious of is thinking about core strength. We know that very often back pain is not all about the bones. It's more likely to be about the also the muscular strength along the core of the spine. And we're also very conscious that during lockdown, people's core strength might have waxed somewhat, and getting going for school again is really important. We know that some of the ligamentous laxity might influence handwriting, other aspects of the school environment, teeth, as I've mentioned, the involvement of the dentists. We also place a big emphasis on the role of sort of healthy food, activity, vitamin D. And I know that Professor Susan Lanham-New is going to spend time on that, which is excellent because I think it's important across the age group. And on the right, I've got boxes there of all the different specialists in the team that can help. The next slide, please. The apologies to everyone. I'm receiving all of these incoming thank yous about the so obvious about not having turned my screen on earlier. So the settings of the healthcare from the OI team, I've really just sort of encapsulated some items here that on the left, some of this would be delivered in hospital. This might be outpatient clinic visits, emergency unscheduled visits, other times of inpatient stays or visits for therapy. And across on the right, encapsulating visits into the community. So that might be when our team are doing school assessments, nursery assessments, and the box on the below with the at-home environment throughout the age group as well. As you all know, we've been grappling with things in different ways recently. We're not delivering the care in the same way. And next slide, Richard. So over recent months, we've all been grappling with technology. I thought I'd mastered it personally, but clearly not turning my video on for the first part of my talk this morning indicates it's not totally worked out. Here's some of my team grappling with how we use the Attend Anywhere software, and you can see the looks of frustration on the top. On the bottom, some of the video quality we had to contend with as we're all staring at screens. An experience across on the right that you're all contending with as well is now we have to grapple with wearing glasses and masks, which means things fog up and we then can't see things. But over the last few weeks, my team have delivered a virtual summer group with some of our children down to 8 years of age. So I think we're all mastering that. Next slide, Richard. And in fact, this is my last summary slide of really on the left, that signal of the hands of throughout the childhood, acknowledging that mild OI can affect people differently in different ways, and some of the things that we're just looking out for. This being the slide which I hand over, I've just put a little image there for you. I'm not sure how many of you are sitting there on the left this morning with when we've got Zoom meetings with audio only or with video. And again, apologies for omitting to turn my video on initially. I did not look like the image on the left initially. I'll hand over to Jude at this point.
Fantastic, thanks Christine. I think you'll hopefully see that the focus is fairly similar in terms of what Christine and I are saying this morning. We did actually speak before we wrote our slides, so maybe that's cheating, but Richard, if I can have my first content slide, thank you. So I was thinking also, what do we mean by mild? And some of these words have got sort of quite emotional overtones sometimes. So normally we're thinking about the bone fragility, I think. So we're thinking about how many fractures and how bad the fractures are. But my experience in clinic is that somebody having a sort of label or diagnosis of mild OI doesn't necessarily reflect the experience that they have of their OI. And Christine's already touched on this a little, and we know that OI affects way more than just the bones. And I think in adults with what one might call mild OI, there are issues with soft tissue, so tendons, ligaments, issues with pain, issues with fatigue, and probably more issues that we don't really even know about potentially yet, because we know that collagen is in multiple tissues in the body. Next slide, please, Richard. So if we're thinking about mild, and again, Christine mentioned the types. So if you consider mild OI would be mostly type 1 OI, and that's the most common form of OI. So about somewhere between about 50 and 60% of people who have OI would be classified as having mild or type 1 OI. That's normally a dominant genetic mutation, so you'd have a 50% chance of passing it on to any children. And in general, people with this type of OI have normal collagen. So if I was to take their collagen and look at it down a microscope, it would be a normal structure of the protein collagen, but they have half as much. Whereas the people who have the more severe type of OI have abnormal collagen. So if I take it and look at it down the microscope, it doesn't fold in the way normal collagen protein would fold, and it doesn't work as well. And I think the other thing with mild OI that we see in our clinic is that it can be diagnosed in adulthood. So it's not uncommon for an adult to not really realise they have OI. Maybe they were the first person in their family. And it's when they have often it's when they have a child and the child is diagnosed with OI that they go along to see one of my paediatric colleagues who looks at the child, sorts the child out, then looks at the parents and says, oh, actually, I think you've got it as well. And then refers people to us. So it can be a bit of a shock sometimes in adulthood to have that diagnosis as well. Next slide, please, Richard. So what would we think the features are? And I've put at the top there, it's really variable. And I think that's true of OI on the whole. Although there's many shared experiences and shared problems, it's really variable for the individual person. In the mild OI phenotype, we tend to see less fractures in adulthood. So fractures tend to drop off through teenage years, and as patients reach their sort of 20s, then we see a lot less fractures. So that's not necessarily something that we're managing. But hypermobility is common. People with mild OI may be normal height, so they don't look any different, although they may be more likely to have the blue sclerae. They can have scoliosis, but it tends to be mild. And obviously there's the hearing and the dental issues, and they can affect any type of OI. Next slide, please, Richard. Thank you. So I was thinking when I was preparing this, how do I, if I'm in my clinic, which I'll tell you how that's changed in a second, how do I approach somebody with mild OI in comparison to somebody with severe OI? And I realised that actually I probably do the same thing. So it's the same focus. Now, Christine's already alluded to changes in clinics and the way things happen. We've moved our OI clinic to a video clinic. We do it as a team. It seems to work reasonably well when the technology works. So our patients can see usually a couple of doctors and a physio and a nurse and a research coordinator all on their screen at the same time, very much like a Zoom meeting, but in a confidential, safe web space for doing that. So how do we approach them? Well, again, not all about fractures. Fractures are important, but holistic. I'm really keen on thinking about my patients as a whole person. And I think in OI, this is really important. So we're trying to help with symptoms. Christine mentioned fatigue, pain, those things that can be troublesome in adolescence, often are troublesome in adulthood as well. We want to do everything we can to maximise bone density. So not necessarily drugs, but all the other things that we should be doing, all of us, for maintaining our bone density. So talking about exercise, talking about diet, and yeah, I know Professor Lanham New is going to talk about that later. I'm really interested to hear what she has to share with us. And then thinking about quality of life, self-management, which is really important, and I think most of our patients are really good at that. And when I say individualised care, I mean that, you know, we're going to look at that person in front of us and what they need to help them to live the best that they can with their OI. Okay, next screen, please, Richard. So this just does this in a sort of picture, but I was thinking about the sort of things that we try and make sure we cover. So some of these I've mentioned already, but we do have a physio in our clinic who pretty much asks everybody about exercise and physical activity. And some people with mild OI can get quite fearful of activity. They worry that they're going to do some damage to themselves, and that's, you know, it's important to stay as active as possible. Support for work and study, that carries on into adulthood. And I think the one thing that here that won't have been on, well, wasn't on any of Christine's slides, is family planning. So although I actually do tend to start talking about this a little bit in the transition clinic. Sometimes my lovely paediatric colleagues look a little bit shocked, but I think it's really important to talk about that early on, as appropriate, obviously, again, looking at the person in front of us and gauging when is the right time to have those sort of conversations. But I think it's really important to look at the whole of the whole of the person, and that we're optimizing things like vitamin D, and making sure that we're fairly regularly checking vitamin D and making sure that's optimized, because we can easily manage that. Okay, next slide, please, Richard. So I just wanted to briefly mention about family planning. So genetics here can inform our discussions, and in the paediatric setting, the majority of patients that come to me in transition have had their genetic testing done, and increasing numbers of people with OI have had their genetics done. We regularly send genetics in our adult patients, particularly around family planning issues. And you may or may not be aware that once the advantage of that is if you know where the little spelling mistake is in the DNA, where the genetic abnormality is, you can then test. You can either test a child when a child is born, or there is there are IVF techniques available to check embryos for OI, and you can go down that path. So basically, you have IVF, they take the embryos, they check which ones have the abnormal gene, and then they would just implant the ones without the abnormal gene. And that's a very, very personal choice, and we tap into specialist services for that. So there's counselling and lots of discussion around that, but that's obviously something that we think about. And I think I've got one more slide, please, Richard. So I am a massive advocate that everybody with OI should have access to a specialist, and preferably a specialist team. Even patients with mild OI, even patients who are doing really well, so that you have access to advice and support, if there's a query or a question, and also so that you have some advocates who can liaise with other professionals. And I've just got to put a photo there. So it's a little bit old, actually. We've got a different physio with us at the moment, but this is the first day we did our OI MDT. You can see it was pre-COVID, because there's no masks and we're all standing very close to each other. And we used to all do it in one room. Now we do it all on video. So so I would, if there's anybody watching or listening or looking at this on YouTube or wherever it's going to be available afterwards with mild OI, and you're not under a specialist, do reach out, because we can, we often will just have an appointment with people who are doing really well once a year, just to check in and just to check that you're having all the relevant any tests and checking vitamin D and basic things. But do get yourself to a specialist if you can. All right, so I think that's the end of my talky bit slides.